Daisy from Quick Core Fitness. I am the creator of this channel, a physical therapist, a Pilates mat instructor, and a health coach. If you like this video, I would love it if you could hit the like button below and share it with your friends and family so the information can get out to more people. And better yet, subscribe to the channel so you won't miss another post or another video. Today, I thought you should know about this treatment called PRP, platelet-rich plasma, in the treatment of some common non-surgical shoulder conditions. But before I begin, I'm going to make a disclaimer. Even though I am a physical therapist, I am in the healthcare field, I am no medical doctor, I am not an orthopedic doctor. So this video is by no means replacing any medical advice, but rather more as a chance for me to share with you what I have learned when I read this review article. And I'm going to reference the name of the article in the description box down below in case you're interested in reading it yourself. So hopefully that will also give you some more information that next time when you go and talk to your doctor or your orthopedic doctor about your condition, you will have a little bit more information and you guys could discuss what is the best treatment options for you. Okay, so let's dive in. So first of all, what is PRP? Like I said, PRP stands for platelet-rich plasma. It is a human blood sample that is drawn from a peripheral vein and is centrifuged into different blood layers, or they centrifuge and separate the blood components into different layers. And it is thought that PRP is rich in growth factors and therefore will encourage healing or the healing process of ligaments, tendon, bone, and muscle. So that basically is the biological basis for the use of PRP, especially in orthopedic conditions. So the review article that I read, they look at the applications and the clinical outcomes of some common surgical and non-surgical shoulder conditions at the time that the article was written. So it's back in 2018. And today we're going to focus on talking about non-surgical shoulder conditions and the use of PRP. Okay, so one of the studies that the review article mentioned, they look at the use of PRP in symptomatic partial rotator cuff tear patients versus CSI, cortisone shot injection or corticosteroid injection. So they try to look at which treatment perhaps may be better than the other. They follow 40 patients and they follow them 3 weeks after injection, 6 weeks, and 12 weeks. And the finding is, number one, both groups show improvement in clinical outcomes. So clinical outcomes often involve questionnaires that may ask you for different body parts. Really, we have clinical outcomes for different body parts that would ask you questions about, how you functions, and they have been validated. So both groups in this case show improvement in clinical outcomes after the treatment. And at the 12-week part after the injection, the group with PRP showed significant progress in clinical outcome scores, but at the 24 marks, there's really no difference between the two groups. So that's one study. Another study, alternatively, they look at PRP versus placebo. In that case, it's a saline injection. And they try to follow those patients 3 weeks, so a little bit earlier this time, 3 weeks, 6 weeks, 12 weeks, 24 weeks, up to a year. And for this study, they actually find no differences between the two groups at the 1 year mark. So the review article also looked at a study that examined patients with calcified tendinitis who have failed traditional therapy like non-steroid anti-inflammatory medications, NSAIDs, like ibuprofen and naproxen, and exercise therapy for 3 months. So for that group, they compare them with a cortisone shot versus PRP. And they follow them 6 weeks and 6 months after the injection. So at 6 months and 6 weeks, both groups showed slight improvement in their functional outcomes and in their pain score. But at 6 months, there is really no change between the groups in shoulder range of motion. The review article mentioned a study that also examined patients with calcified tendinitis, but this time the researchers want to compare them using 3 months of target physical therapy versus a series of 2 PRP injections. And they followed those patients for 1 month and 3 months. At the end of study period, both groups show progress in the outcome scores, in clinical outcome scores. But the patients or the group who receive 3 months of target physical therapy show significant superior, and I quote them, significant superior improvement in pain as well as in shoulder range of motion. Yay! So at the time when the review article is written, there are no clinical studies that are published that look at the use of PRP in patients with biceps tendinopathy, as well as patients with labrum tears. So to summarize, up till the time that this review article was written in 2018, there were some benefits that were shown in the use of PRP in non-surgical treatments for patients with partial rotator cuff tears that are symptomatic. But at the same time, there's also studies that show no clear benefits. But it is also worthy to mention that there is no published risk or adverse side effects of using PRP. Now, PRP, because it's not proven yet by literature, most of the insurance wouldn't cover the cost of PRP. And some of them range from a few $100s to a few $1,000s. There is a huge variability in terms of the preparation of PRP and also the components of growth factors, platelets, or leukocytes in the blood samples between patients or even within the patients. And perhaps because of that, it explains why it's difficult to show some consistency in the clinical studies, because there is such variability in the preparation of PRP itself and also in the application of PRP. But since there is no published risk in terms of using this treatment, perhaps it could be a viable treatment for patients, especially if cortisone shot injection is not an option. So perhaps PRP can be something that you and your doctors could discuss and think about. Would that be an option for you in the treatment of your shoulder conditions? So thank you so much for tuning in today. I hope you would come back next time when I talk about PRP and its applications in surgical conditions for the shoulders. Bye now.